have a large amount of respect for the physicians in EEP and the care they deliver to patients every single day. But we need to be able to maximize our emergency department in a way that we haven't had to in the past.
PeaceHealth Oregon revealed today the deciding factor for ending its contract with Eugene Emergency Physicians boiled down to scaling its emergency department. One hospital executive explained PeaceHealth turned to Georgia-based ApolloMD for physician management services in hopes to grow the department. PeaceHealth Oregon Chief Hospital Executive Dr. Jim McGovern says PeaceHealth ended its emergency management services through Eugene Emergency Physicians because EEP wouldn't be able to take its emergency departments to the next stage in quality care. What would make this contract work where EEP stopped working?
Apollo has national resources that EEP just doesn't have access to. There's a complete package that ApolloMD can work as a local group and have national support that EEP just can't provide.
ApolloMD currently staffs medical facilities across 19 states and more than 100 medical practices. PeaceHealth dropped EEP for ApolloMD to staff all 3 of its Lane County medical centers, marking the company's initial footprint in Oregon.
We have project managers that help follow up on emergency department redesign. We have an entire patient experience team. We have a throughput team that maps out the patient journey and figures out how do we make each point of interaction for a patient smoother so they can navigate this process throughout the hospital. And these are resources that, as a small group, it's really hard to kind of cultivate and afford.
A concern brought up by EEP is corporate money being contributed to ApolloMD.
Certainly when we're looking at a corporate medical group which has nationwide coverage and is currently and has very recently been backed by private equity funding, a local emergency physician group is not able to match the resources that ApolloMD has to bring.
Patel says ApolloMD has never been backed by private equity and it's physician-led. Meanwhile, EEP says medical staff felt hospital leadership wasn't forthcoming at the onset of the request for proposal process, saying they were told the hospital had to choose the most financially appropriate contract.
We certainly have had some financial challenges. I think the number that I've used is our net cash flow is a negative $800 million over the last 4 fiscal years. That has led to layoffs, some restructuring, a number of leadership changes. It did not play a role in this decision.
ApolloMD said its doors are open to the 41 physicians and physicians' assistants with EEP to return to the hospital, though all 41 have signed a pledge stating they would not. Regardless, ApolloMD says it will fulfill its commitment to PeaceHealth. Patel says they've hired a few people already and another 59 clinicians are currently being credentialed. This month, the majority of both medical staff and nurses at PeaceHealth Riverbend voted no confidence in McGovern and Chief Medical Officer Dr. Kim Rusher. McGovern says though they will work to better include staff in decision-making processes, he stands on their decision to switch to ApolloMD.
So I think what I would say is I'm sorry. I know this is an incredibly difficult decision. It's clearly disruptive. I still believe it is the right decision that we made.
Several state legislators and U.S. Representative Val Hoyle have all expressed concern over the hospital's decision. Some sought clarity on ApolloMD's compliance with Senate Bill 951, a law passed last session that limits corporate control over medical decisions. On Thursday, EEP will bring the issue before an Oregon Senate committee.